Hello, everyone. This is Dr. Khan. I'm going to go ahead and invite my guest. Um, Thank you very much for everyone to come in and join. I am looking forward to this very exciting and very interesting Facebook Live. I'm connecting with Dr. Henry Dijkman from the Netherlands. So if you could just bear with me. Invited. And then add. All right. So connecting.
Yes, good
Yes. Hello,
afternoon.
sir. Hi. Yes, good afternoon. Sir, good to see you. It's a pleasure to join you again. I am going to go ahead and check. Thank you very much, Lori. I appreciate it. So I'm going to go ahead and just want to make sure everything is looking good on my end. Thank you so much for joining us. And it is very interesting to collaborate and work with you, sir, and to basically study this very important topic that's literally affecting what I would say not only hundreds of thousands, but millions of ladies across not only the US, Europe, but the world. And so what we want to do is we want to investigate slash shed light, enhance the understanding of what we understand as what is breast implant illness, how I as a physician, as an MD, basically want to look at it. We've got a couple more minutes just so that we have our uh, audience that will listen in the next couple of minutes. We'll go ahead and get started shortly. So the reason why we're doing this 3 o'clock is it's 9 p.m. actually in the Netherlands, and Dr. Henry Dijkman is basically doing this at 9 p.m. His time. He's 6 hours ahead of us, and so we're very gracious to him for his time. I find on the weekends everyone's busy, and so this is an optimal time in the middle of the week so that everyone can listen. And I request everyone to share this knowledge, this information. You know, as you will see, there is hard data, there is evidence as to what we're going to discuss. And I welcome you, Dr. Henry Dijkman, for your time and efforts and your expertise and basically sharing with us your knowledge and your experience, what we have done lately. So we'll wait a minute or so before we officially get started. Please go ahead, Dr. Dijkman. I will leave it up to you for a few words.
Now, the pleasure is totally mine. So I'm very happy to discuss this topic with you. So I think we share a lot of knowledge, and Dr. Khan, Shaher Khan, of course, he sees all the patients and the clinical side and the clinical aspects. And what we do is looking in the tissues and looking what is going on there. And this time we have looked at a breast implant, and then filled with physiological salt. And we were interested in the surface and the topography of that implant. And also we looked, of course, at the inside, what's going on there. So, and hopefully we can discuss the different topics.
Yes, yes, absolutely. Now, having said this, I will officially go ahead and get started. This is Dr. Shaher Khan. I will go ahead and introduce myself first, and then, sir, I'll have you introduce yourself so that everyone understands as to who we are and what our credentials and training. So I'm Dr. Shaher Khan. I'm a board-certified general surgeon, having done 5 years of training from literally trauma to gut to chest, as a general surgeon. I'm also a board certified burn surgeon, having done basically critical care in burns. And then 3 years of plastics training. That is a total combined 10 years of training. Where I'm a board certified plastic surgeon by the one and only board that authenticates and certifies plastic surgeons, the American Society of Plastic Surgeons. So my practice initially was everything but implants. I've only implanted only once in my life, and it was a young lady in her early 30s. She had reconstruction secondary to cancer. And this was one reconstruction that I did in order to get board certified. But this is one topic that I basically did not do. And now over the years, I did explant. I did not believe in augmentation, for I did not want to hurt. And now my practice exclusively is what is explant surgery, removal of implants, both saline and silicone. Now, having said this, sir, if you could please introduce yourself and what is your training and your level of expertise.
Okay, thank you, Shaher. No, I'm Henry Dijkman, and I'm a specialist in cell, tissue, and pathology and nanotechnology. And I'm a scientist, lecturer in medical science. And my research topics are especially nephrology and nephropathology, but also all sorts of pathology and toxicology. So, and approximately 20 years ago, I was connected with a plastic surgeon for a question about silicon toxicity and what's going on in the tissue. And so I did some studies. Of course, the most important thing was set up a technique. And so we set up the three-phase technique. But what was much more important is trying to look for controls, knowing for sure that all the silicon what migrated was really silicon. So we did that with a lot of tests on low profile because we had no money and not so much time. So approximately 10 years ago, then it was a little bit much heavier. Then we knew that there was something wrong, that all silicon implants leaked, and gel bleed is of course known, but in time the leakage increases. And also the surface is very important, the topography of the surface. And so the last 5 years, it's very heavy stuff, I think. And awareness is growing, and we know for now, and also I'm happy, very happy to work with you, Dr. Shaher, because it's so important to create awareness what's going on in the patient. And of course, when there are no problems or no clinical symptoms, okay for so far, but we know that it's a burden in the body. But what is very important to know is when you get complaints which matches with breast implant illness, then we know for sure that silicon migration occurs and that there is a lot of going on in the body. So, and I think the last years we have. Yeah, of course.
No, sorry. Please, if you could finish your thought. I just wanted to ask, you said surface topography. If you can, I understand what that means, but if you could please help the listeners understand what that term means.
Now, the last years, we know a lot of Allergan before approximately. Allergan has the BioCell implants, and what we saw there is that is a very rough surface, so that we also call texture, and that texture, that rough surface can be approximately 80 to 90 microns. So that's a really rough surface, and really smooth, then the surface topography is approximately 0 microns, so really smooth. And what we know is that the texture is important for affecting the immune system and give stress to cells. And now there are new studies who say approximately a texture or a surface of approximately 4 microns would be the better option, because then macrophages and capsule formation would be lesser. But what we also see is that maybe everyone knows, if you have a silicon implant with physiological salt or a real silicon implant with also silicon at the inside, the shell is always made of PDMS, so that's polydimethylsiloxane, and PDMS, that degrades in the body, and we show that because macrophages, they eat the implant. And so
Sure. And
pores and
macrophages, just
the
for
temperature.
the yeah. For the listeners, the macrophages are the body's own immune system cells that clean up debris, foreign matter, and it basically help with the immune response. If there is a foreign body, for example, they will digest, clean it up, and enzymatically break it down. And a cluster of macrophages are called what is a giant cell reaction, where they group together and try to basically overcome what is this foreign body, and which we see classically in the pathology reports where the body is trying to fight the silicone. Now, having said this, you know, you have had many interesting publications over the past few years. The one where you did a patient, she had ruptured implants, and she had what was basically gel bleed of the silicone to almost all the different organ systems of the body. And this is one of the papers that you have published in this lady who donated her body for the advancement of science, and where you studied and did the biopsy of the many different tissues, including the nervous tissue, spleen, liver, and the brain, and concluded definitively via electron microscopy and also energy dispersive x-rays that this is indeed what is breast implant illness and the silicon toxicity that basically is distributed all over. Now, what I want to do, sir, is almost a couple, 6 weeks ago or so, I sent over what were intact saline implants, 510 cc's on the right, 510 cc's on the left, saline implants intact. I FedExed them over to you, and I sent them over in its own basically biohazard bag. And these were and from a patient who benefited from the explant surgery. She has had resolution of her many BII symptoms. This was done early on in the month of September. Now, once you received those the saline implants, the outer shell, which is what you describe, is the silicon texture, silicon composed saline implants, meaning whenever you say these are saline implants, the outer circumference, the shell, if you will, is the silicone. The saline itself inside is sodium chloride. That's the saline, which is the balanced, you know, the saltwater solution. So once you received those saline implants, can you please tell us what exactly you did with them and how you processed the specimen, the sample?
Now, we are always interested in what and how the surface look like. So we will investigate the surface with scanning electron microscopy. So that's a microscope which goes to 20 or 30,000 times magnification. And then we look at the surface. Wow. If there is some texture, if there is pores, etc., etc. So, or biodegradation, of course. So now, and in this case, because these are saline implants, we have investigated the outside of the implant, we have investigated the inside of the implant, and we tried to investigate the solution itself, if it contains silicon molecules. Yes. Now, and that was very heavy stuff. Then normally, of course, what we see is in a silicon, full-filled silicon implant, the silicon is a sort of pudding, is cohesive. And what we see in time, after biodegradation, that cohesive gel can become fluid again. So there is biodegradation. Now, and for now, our question was, is that shell of the saline implant at the inside or at the outside, is there also some signs of biodegradation? And can we find solid molecules in the solution? Now, and for that, we have centrifuged the solution. So out of both implants, we took 500 milliliters saline. And so macroscopically, we saw nothing. It was a very clear solution. So there was no bacteria or debris.
You took the saline, sorry to jump in. So you took the saline and you centrifuged it, like you were telling me, at 11,000 rotations per minute for a total of 1 hour, correct? So you
Yes.
took the
So
saline
we
and
took
you
the
sent the
saline
saline
out.
from the saline implant, you centrifuged. Tell us, please,
Yeah.
how you
And
process
so we
those
centrifuged it.
the saline from those saline implants. Yes.
Yeah, so it was in total 1 liter, so 1,000 milliliters. So and we processed that in big tubes, and then we centrifuged it in a very big centrifuge at 10,000 RPMs for 60 minutes. And then after an hour, we found a very, very small pellet, a very small sediment. And so we extracted that, and that I have dried and sputter coated. That's a technique so that you get a better image in the scanning electron microscope. And then what we saw is that I have very little, I must say, very little than in a normal silicon implant. There is much more gel bleed, but also the surface of a saline implant, there is some biodegradation also at the inside. And we saw very, very small spherical balls. And those spherical balls, they were of course, at the inside of the surface of the shell, but also we found those same spherical balls, sometimes a little bit smaller, in that sediment. It was very little, but it was there. And then we measured those balls, if that was really silicon, and we could indeed measure that it was pure silicon.
How did you measure it was indeed silicon? For as being a devil's advocate, how would you say definitively it is indeed silicon?
Now, what we do, and maybe some people know that, we have set up a technique, and that's the three-phase technique. And with the three-phase technique, that is, one is a light microscopy. Then, of course, when you look in tissue, etc., all the cells and environment is very important. So what is going on there? Is there a chronic inflammatory reaction? Are there histiocytes, macrophages? You have already explained that, what they are, and what is going on there. So that's the first step. The second one is the Moro staining, and that's a very specific staining to really specific, that's a modified oil red staining, very specific for silicon and polymers, and then you see a very nice red deposit. And then to complete that, so to be absolutely sure, we also work with energy dispersive X-ray microanalysis, so EDX, and with that we can really measure the elements in the solution. Now, and what we see in controls, there you will never find such high peaks of pure silicon. And so we could measure a very nice peak of pure silicon in those spherical balls. And in the last 10 years, we did so much measurement.
So you have come definitively as an expert, sorry to jump in, for the listeners, you have definitively 100% completely and convincingly proven to me, given your history as a scientist, having looked at silicon and the controls, what was collected at the sediment, be it small, that these were small spheres of silicon that were disintegrated from the shell, inner shell of the saline implant, such that they were free floating within the saline content of the intact saline implant. So this is pretty remarkable data, because if it's going into the saline, absolutely, it is going into the periphery, into the body, and basically bleeding. And this is exactly what you published in a couple of months ago, the gel bleed, and what you have been seeing all along. Now, please go ahead, and sir, I just wanted to highlight, because there is no doubt, because there is a group of people, scientists, or some physicians who state that you get the silica from your toothpaste, from the plastic cup that you drink.
Yeah.
Well, all of that is put to rest. None of that holds true because we knew that was their reasoning behind, but there's absolutely no justification whatsoever in their argument by stating that this is basically incorporated in the food diet or the bottled water that we drink that may have potentially given the silica that is seen elsewhere in the body. So this is classically, as you have demonstrated, sir, the silica that has bled into the saline, and that is what you showed, and I believe for the first time, right? Because are you aware of any studies that show that the saline within, at least to my knowledge, has in it the small spheres of silicon?
No, I have never read that, and I have also never seen that. But I have already discussed with you, of course, that the gel bleed in a pure silicone implant is much, much higher. And also when we are looking in tissues, and I also work together with a plastic surgeon, José Budeau, and he has implanted a lot of saline implants, but not so big. He says that the maximum volume must be 250 milliliters and smooth, but he saw not so much complaints. But on the other hand, the surface of the implant can create capsule formation, of course. And also at the surface of a saline implant, there is biodegradation. So what we see in the capsule of a saline implant, sometimes we can find some small molecules. But what we now see, maybe those molecules will migrate directly already in the body. Or those women are maybe a little bit more sensitive, and that the triggering of the surface is already enough, because the surface of the shell is of silicon. But what we also see is when we look at really silicon-filled implants, then there is much more migration. And so when migration increases, also the chronic inflammatory response increases, and also often the capsule thickness. So then, and hopefully we publish within a few weeks a new story about Baker 1 and Baker 4 capsules and the difference in silicon migration. But this study was really interesting. So what we see is...
Yes, please go ahead.
Now, yeah, this study also is very interesting. Then I think everything what you put into the body, especially silicon implants, there will be a triggering of the immune system. And so when there is a triggering of the immune system, and that is also what we stated in the last paper to JAMA Open Network, is that when you get triggering of the immune system, you will get an inflammatory response. And so the chronic inflammatory response, there is always a reaction there. So every person, also when you have no complaints, in every person, then I have now also a lot of patients, but also in that study in JAMA, we had patients with rupture, and a lot of criticisms are saying there is a bias in the patient group, and that were only patients with rupture. But we know that there were also a group of patients in that study who had them for 5 years or 8 years, and they got complaints. And in all those capsules, we saw exactly the same chronic inflammatory reaction with migration of silicon in the capsule and outside the capsule. Now, what we see in a saline implant is, of course, of a lesser degree, but there is also interaction with the surface.
Right, right, right. Now, what is interesting is, if I may mention, you know, for the human body, the immune response, if you look at the spheres of the 20 to 30,000 magnification, 30 times 1,000 magnification under the electron microscopy, you look at the hepatitis C virus, the hepatitis B, HIV, or look at the COVID virus, for example, that small virus. It is nano, super small. That in itself is enough for the body to trigger an immune response and potentially kill the patient, right? This is what we're seeing with the COVID response or the Hep C, where the whole body now, just from a super ultra small microscopic virus, which is much smaller than what is a sphere of those silica that you isolated. So the point I'm trying to make is, yes, you did see small amount of silica, but that small amount of silica is enough for the human body to be triggering an immune response that results in the fatigue, the hair loss, the silicon mastitis, the gastroenteritis, the migraines, the neck and back pain, the vision changes, all of the symptoms that we know of what is breast implant illness. So the point here is, yes, it's a small amount, but that small amount, it can create havoc and misery for the patient, consistent with what is breast implant illness. Now, the other thing here is, now, what you mentioned on the last Facebook Live is when you have gel implants, and this is what you just echoed right now, silicone gel implants, you have more of a migration, more of a gel bleed, since there is a higher concentration of silicone, especially in those patients who have a rupture of a silicone implant because there is no shell. So now there is more, or a much to a higher intensity migration of that gel bleed, and hence a bigger response. So today, if you look at my scrubs, I literally just half an hour ago finished a patient that came to me from Missouri, and she had 6-year-old breast implants, silicone, and she was ruptured on the left, just 6 years. I did a case 3 months ago.
Mm.
She had implant, silicone implant, just 3 years old. And she was ruptured also on the left side. And the point I'm trying to make here is, this was a silent rupture. The patient was not aware. I did not get an MRI on her. And look, in 6 years, she had a rupture. And God knows she might have been ruptured for a year, 6 months, 2 months, God knows when. And these implants only create havoc. Now, I'm going to suggest one thing. If I may put you on hold for 1 second, please wait. As you see, I did a set of implants from a patient a couple of weeks ago or last week, where this patient had what is silicone implant on the inside. So this was the implant that was popular in the 80s. So she has a saline implant in which there is a silicone implant intact, and you can see the consistency on the right side, at least, that the silicone implant is intact. And this is encased in a saline implant. This is how one of the manufacturers was doing it. So you have, in this case, a saline implant in which is the silicone implant, and all preserved intact. Now, I'm just curious. Now, the reason why this is brown is because there is betadine that was likely inserted in the saline that gave it that brown texture. This is an old-fashioned surgeon who basically put the beta, which basically nullifies the guarantee or the warranty of the implant. But what I'm curious to see now is, and this is just a thought, and again, more research needs to be done, but this is a first study of its kind where Dr. Henry Dijkman evaluated. I'm curious to see what is the content or the silicone concentration of the centrifuge if you were to do the saline, because that silicone implant is certainly very much gel bleeding. There is surface degradation, and you will see a much higher concentration of silicon in this centrifuge pellet, because you not only have the saline on the inside breaking down and releasing into the saline, but you have the intact silicone that's leaching, bleeding into the periphery, the saline. So this is where
Mm.
I can tell we don't need to do the study, because we know there it's going to be silicon. And I want the leadership in the biomedical engineering, the manufacturers, the other plastic surgery groups, other biochemists, not only in the Netherlands, but elsewhere, to basically look at this and say, you know what, we have, at least from this conclusive evidence, I use the word conclusive evidence, and this highlights to what the FDA said last October of this year, where they're now mandating the plastic surgeon to sit down and discuss with the prospective patient that the implants are not meant to be in the body forever. Look, 10 to 15 years. Look, in this case that I just did a few minutes ago, left breast implant silicon was ruptured, the silent rupture. This is the FDA warning, the BIALCL, the lymphoma in the textured implant that you just mentioned, that the surface is very important. And number three, the many symptoms of BII. Number one, the first question is how much of that has been implemented by the plastic surgeons to date in the last couple of weeks since that quote FDA mandate became effective? And then I asked the FDA, the Department of Health, the ministries of health across the world to step up and take the leadership role and say, you know what, yes, we actually have active gel bleed. What your papers prove convincingly, this is electron microscopy. There is no denying the fact. These are controls, like you mentioned. And we put a halt to augmentation in itself, hold augmentation such that the patients basically are not harmed, and we investigate and further look into. I always, if you can give me a second, I'm going to turn the sensor lights on. So I also request the FDA, if I may mention, that they basically step up and take the leadership role and say, you know what, we're going to halt augmentation till we further define what is safety profile of these implants that are gel bleeding, like you very well have shown. We want the FDA to step up and mandate the insurance companies, Medicare, and all these insurance agencies to accept BII, to have an ICD-10 code. So these many, not tens of thousands, not hundreds of thousands, but millions of patients, not only in the US, but not only in the Netherlands, but across the world, in South America, in Europe, in the Middle East, so that they get their resolution of their many signs, symptoms of breast implant illness. Because one thing I want to highlight as a clinician, as a physician, that this gel bleed that you have very well mentioned occurs from day one. And that is so true, because I clinically, when I remove even intact implants, I removed a set of implants last week from a patient. She had implants just 2 years, 2019, and she started reacting, and she had almost all the check boxes on my questionnaire. It's not fair for her to be suffering and be in misery when we know, when we have this data, when we have this proof that clearly outlines the detrimental effects of silicone and saline implants, and that it is only proper and professional and right that we basically not hurt but help our patients. Dr. Dijkman, please, if you could go ahead and add.
Yeah, I totally agree with you, Sharkan. This is so important, and what is for me is very important is that now in the Netherlands, the NVPC is really saying all implants are safe. Now, and in my opinion, silicone breast implants are not safe. The safety is never proven. So, but what for me is the most important thing is when patients have implants and they create signs of breast implant illness, then you have to be serious and they have to be explanted. And the explantation must be doing very well, so as you do, removing all the capsules and try to clean up the whole mess. And what I see now, today I had 2 new patients via the mail that they had some complaints. One of those patients had 9 years Allergan. She had complaints 2 years ago. They had made some investigations and they had no diagnosis. So she was sent home the breast implants are fine, no problem at all. And now 2 years later, she has a rupture. She has silicon all over her body in the lymph nodes. So that's a snowstorm image. So that's, for me, we have to provide more awareness. It's so important to save those patients, because when you get complaints, you need help. And you can't wait until you get a rupture.
Right. No,
Then
absolutely.
so
Right. No,
and
I
when
couldn't
they
agree with
say,
you more.
oh,
When the
after
red
10 or
flags
20
start
years,
going up, yeah. No,
yes,
please go ahead.
exactly. And what we see is that I have now a bunch of patients who have a rupture after 5 years, 6 years, 8 years, 9 years. So what is very important, and that states also the FDA, after 5 years, try to make an MRI. Look if there is everything okay. And then every 3 years. But much more important, when you feel breast pain or when you get complaints like breast implant illness, be aware of it. And doctors and plastic surgeons must also be aware. Then now at the moment in the Netherlands, they still state nothing going wrong. There is no causal proof for those patients and silicone breast implants. And so they say nothing, there is nothing going on, no problem at all. And I see so much patients hurting, and they are really sick. And what is the best? When you explant those
Right.
patients, they totally recover. So what that for
Right.
me is the real proof. And I'm so
Right. That is
happy
clinical
with
proof.
plastic
Uh,
surgeons like you.
No, what you said is very smart. You have microscopic proof on the electron microscopy level, and that is clinically translated into our patients that we see, my patients, that improve dramatically when the surgery is done right. Now, this is very important because you not only have scientific data, but you have clinical data that highlights the proper explantation technique yields a happier patient, a patient that is free of the misery of the many symptoms. And you not only need to just talk, you just look at their pictures before and after, and one will be thoroughly convinced that this is indeed what is breast implant illness. Now, what is very important to note here is that there is enough data. We have the data. There is no second guessing. We have, I said there was a patient I took care of a couple of weeks ago. Her husband had a lung transplant, bilateral lung transplant, and a kidney transplant in 2014. God bless his soul. And I said, we have made advances where people are walking around with bilateral lung transplants and kidney, but this is 1 + 1 is 2. This is as simple as silicon toxicity. We have your data. We have Dr. Jonathan Mowers, who is the MD, PhD pathologist, and the other colleagues, the pathologist of Dr. Mowers, who basically have convincingly, again, looking under the microscope at the capsules, shown chronic inflammation, giant cell reaction, histiocytic reaction. This is the refractile material consistent with silica and the chronic acute inflammation that we see. And we see just by visualization grossly the weepy tissue that basically is very inflamed and hurting and weeping fluid because it is so quote toxic. And you can only examine. I had a patient came in 2 days ago in my clinic. You touched her and she would jump up, and she was very much hurting. Grade 4 capsular contracture, grade 4. And this is a young lady in her 30s. That's a young mom of 2 kids. Just like you said, it is not fair for her. We have the leadership role to step up and say, absolutely, this needs to stop, because we're not second guessing. We're looking at hard evidence. And if I may mention, we have 4 groups of people, like I've mentioned in my Facebook lives before. You have the manufacturers. They certainly are not doing anything about it. You have the FDA, the departments of health, they're sitting passively looking the other way and saying it's safe. You have the plastic surgeons and the medical community literally mute and not attesting or basically convinced that this is indeed what is breast implant illness, and not even giving breast implant illness a chance for recognition, just looking the other way with zero tolerance, and not even accepting that it even exists, and calling it a myth among other problems, which certainly is not. It is a real problem with a real solution. Lastly, you have the ladies that are speaking in the masses, in the volumes, in the tens and hundreds of thousands. And it is the women that basically are screaming out loud, and not only them, but their husbands and their significant others, their kids, and saying that this is, we're crying out foul. There's so many red flags. And this is unfortunately telling or convincing the FDA to, at least in a very passive, non-assertive way, stepping up and slowly trying to change the system. So I find it's very important for the plastic surgeons, everyone, to acknowledge, because we have clear evidence. There's, especially when we see that there is gel bleed that is occurring, and your data, one needs to just analyze to be convinced it is the same mastitis that someone gets when they inject high-grade silicone into the buttock area that some people have unprofessionally done. And it's the same inflammation that is noted when there is a rupture of an implant in the periphery, with the silicon granulomas that form, clearly consistent with what is breast implant illness, in a different form because of the frank spillage of the silicone. Silicone is not safe,
Totally
just by
agree.
putting in a drain. And basically, yeah, silicone is not safe just by putting in a drain and a rupture, hoping that the silicone is going to flow out. That is very naive and very wrong. And the right technique in this case, and where I quote exactly agree with you, is the entirety of the implant plus the capsule plus any inflamed tissue must be definitively removed 100%, such that there is no inflammatory burden left behind. The care, the sophistication, such that all inflamed tissue is removed, such that once the surgery is done, the patient gets a fair chance to bounce back, minus all that gel bleed that has occurred in the periphery. As you will see, the many pockets of fat necrosis slash silicon that has deposited within the fatty tissue, all of that needs to go. So it's not the thinness of the capsule that determines the good plastic surgeon. It is the good plastic surgeon that takes his or her time to dissect off of the rib underneath the muscle, in vast majority of the cases, or if it is above, such that the entire implant capsule plus any inflamed tissue is definitively 100% removed, such that the 100% of the time, 100% of the capsule is removed, with 0% of the capsule remaining behind. And it absolutely 100% can be done very safely. As you will see, other data is coming out where people and the surgeons are reporting that explant capsulectomy 100% and can be done safely. And it is what I would say is going to very soon to be established to be the standard of care, without the need for drains. To date, I have 1 more week of surgery, 4 more days till the end of the year. And I will tell you happily and humbly, I have not used drains in any of my patients. And because I did the technique in that right proper plane, such that I removed all the burden and the patient had a fair chance to bounce back. Now, Dr. Henry Dijkman, can you suggest what are the implications? What are the findings? What is it that you want, or what you would suggest we do next in order to convince the medical community? Because I get this asked a lot. We have the data, what you and I have, but how can we convince, how can we tell the higher authority, the big powers, that this is absolutely right, and the standard of care should be explantation done right with the capsules, and that the patients deserve a chance to speak and to get the surgeries that they get in insurance, backup with insurance and ICD-10 code as a real diagnosis, so that people have a diagnosis and people have the right cure. Please go ahead.
Now for that, I have 3 very important points. The first point, you have already mentioned that a lot of plastic surgeons say, yeah, silicone is everywhere. It's also in your toothpaste. Now that is totally hogwash. then I have seen so much controls, and I can never measure silicon in normal patients without silicon breast implants. You will never find such high amounts of free silicon, so not bound with aluminium or magnesium, and then that's a silicate, but free silicon you will never find in a control patient. So that's one. Two is, they say, yeah, but there are lots of patients. Then in the Netherlands, 20,000 a year. There are so much patients, though they have no complaints. But what I see is all silicon breast implants, and also the saline implants, but all silicon and breast implants, they bleed. They bleed from day one. So you get molecules, so you get toxifications in your body. Also, when you have no complaints, you will poison yourself a little bit. So your whole body and immune system is detoxing every day. So fatigue is the most common problem. And so also when you have no problems, when you wear silicone breast implants, that is exhaustion of your body, exhaustion of your immune system. And sooner or later you get some problems. Silicon in your body is not healthy.
Right.
So, and then the last remark is, a lot of plastic surgeons say we see no problems when we take out the capsules. There's nothing wrong, but they almost never investigate those capsules. And now I ask the patients, when you get an explantation, please ask to investigate the capsules. And now what we see is a very increased number of capsules of women with a little bit complaints or no complaints, but they don't want the implants because they are now aware of the problem. And what we see is that in all those capsules, we find a chronic inflammatory reaction with silicon migration. And so it's not healthy. So the proof and the numbers are increasing, but the most important thing is, when you get complaints, take those patients seriously, and they have to be explanted. You have to help them to recover. Don't wait until you get a rupture, and then you have a big problem. Then when you have silicon in your lymph nodes, then it's you are much too far.
It's too late. It's too late when you have the silicon in the lymph nodes, because it's spread to the. Now let me ask you. The important question here is this: the silicon is starting to affect the body negatively from day one, from the moment the patient gets the implants. Now, one person asked me, they did a documentary on me from Los Angeles. They flew a patient out and they asked me, what % of the patients get breast implant illness? And I said 100%. And she looked at me and she said, wow, what are you talking about? 100%, that's a little bit over dramatic. And I said, guess what? The FDA said they're not meant to be in the body forever, right? Number one. Number two, look, just today, 39-year-old lady comes to me with a ruptured left breast implant, 6 years old, silent rupture. Can you guarantee me that? And she had no major significant complaints where she's holding her hand on her chest. She's walking about, smiling, laughing, having a full conversation, meaning she's not sick. She is not febrile. 6-year-old, just today. I finished the case 2 hours ago. She had a ruptured left. How can you tell that next lady who's going to get the augmentation, that's not going to be her? Number two, they're not meant to be in the body forever. You could have a rupture after 2 years, or a reaction after 5 years, or after 10 years. Maybe not. And if it's a young lady in her 20s and she gets implants, for example, saline or silicone, if every 10 years she's changing her implants and she lives to the average age of 82 in the US, for example, she has at least 6 times in her lifetime, at least change the implants, and a lot of inflammation, lymphoma potential risk. You have pain, capsular contracture, infection. You have inability to exercise, compromise of the pectoralis function, amongst not able to get a good mammogram because it obscures the self-monthly breast exam, or a mammogram that may hide a breast cancer that might not be appropriately picked up, amongst all the many other problems. And this is where I say breast implants are not worth it. They're only replete with problems. And the smarter thing to do is you could have a silent rupture. So what you're saying is take your patient seriously. I take it up a next notch and say it's better to take care of a small fire than to take care of a big fire. And this is where you don't want to wait for the flames to be so high, or the pain is starting and now, okay, I'm going to get explanted. And the next thing you know, you go in 3 months, 6 months. Yesterday, I took care of a patient, my patient yesterday. She had saline implants. She came to me in October, 2 months ago. Intact saline, intact saline. Exam is remarkable for capsular contracture grade 3 on the left side. She calls me on my text, she texts me on my cell phone, and she says the left one has gone down significantly. And I said, that's a rupture. And she said, yes, I suspect. And lo and behold, just yesterday, 24 hours ago, I did that lady, and she, lo and behold, had a rupture of the left saline implant. She waited 2 months, and we bumped a case, and we had an opening, and we put her on the schedule, and she has attested to the fact on my Facebook live, on my Facebook page. She got the date sooner because she waited the 2 months. Had she gotten her surgery the very next day of seeing me, that saline implant would have been intact. And because she waited the 2 months, emergently trying to get her surgery, the saline had already left her body, meaning they left the implant, had dissolved into the body, and the same microspheres that you saw in your palate, guess what? The saline has made it to the rest of the body, to the lymph nodes. Guess what? That damage is done. So I say to you, an ounce of prevention is better than a pound of cure. And basically, you need to prevent the badness. And in this case, number one, don't get the implant. Number two, get it out. And I can only do so many of these in a year. I'm already maxed out. And the point I'm trying to make here is to the many ladies in the rest of the world who are listening, who will listen, pass it on to the next, because implants are only problem. They're only replete with problem. Prevent this small fire from a matchstick that may potentially be a big explosion or rupture, and you're better off. These one patient described very well, a ticking time bomb. You don't want it, or you're playing musical chairs. Very soon your time will be up. And this lady from today, 6 years. And the lady from Kentucky, young 27-year-old, rupture in 3 years. Or what are these cohesive implants? They're absolutely not safe. They ruptured in 3 years, and it was a Facebook Live I did. You could be living 15 years, but you don't want to play the Russian roulette with these implants. And then when you're ruptured, a little bit too late, and the damage is, you've already spilled the milk. It's too late. Now, what I'm going to do, sir, is please, I will let you make a comment or two. Please go ahead.
Yeah, Dr. Shah Khan, I can't say it better. So you explained it totally right, and I'm so happy with your comments. And here in the Netherlands, I get a lot of criticism, and a lot of plastic surgeons say you are totally crazy. Then there is nothing going on, and silicone breast implants are safe. But I say 10 to 20% of the women become really sick between the 5 and the 15 years, and the rest, I totally agree with you. I have already said that in an interview in 2019, that I'm convinced that sooner or later everyone will get ill, because silicone toxicity is something which starts at day one, and you toxify your body. And so some people are very strong, and some people are very sensitive, but sooner or later you get problems.
Right.
And why do you choose to burden your body? So I'm so happy with your comments, Dr. Shah Khan, it's so important for me that there are plastic surgeons who really know what's going on there. Then sometimes I think that some plastic surgeons only looking or thinking about the money, but the patients are much more important. And I'm also aware that for some people, a silicone implant is a sort of quality of life. But on the other hand, I often hear that when those patients would know what the problems are or would know what the danger is, then they would never start with them. So awareness and transparent information is so important, and we must spread the news that all silicone breast implants leak, and that silicone is not inert, and that every implant creates a chronic inflammatory reaction. And I tell all the students in medicine education that when you have a chronic inflammatory reaction, it's very bad for your body. So what's going on in this
Right. Absolutely.
world?
Um, I asked Dr. Jonathan Mowers, would you recommend, as a pathologist, MD, PhD, is board certified, that young ladies get breast implants? He said, well, I look at a slide and I see in chronic inflammation, one after another. I would not recommend inflammation be given to a young patient. And this is exactly what the pathologist has echoed what you're saying. Now, if I may mention, a couple of minutes ago, you had mentioned people call you crazy. Trust me, I will tell you, people have said I'm weird, I'm crazy, I'm out of basically my zone, if you will. And I will tell you, all what I'm looking at is what walks like a duck, quacks like a duck, it is a duck. And in this case, you have a silicon toxicity and you have defined 100%. I'm not delusional. I don't drink, I don't smoke, and I look at the evidence, I look at your work, it speaks for itself, volumes. You should be, if you ask me, commended on your work that you have very clearly shown that is true scientific evidence literature and time. Mark my words to everyone. Mark my words, very soon there will come a time where the implants will only be banned because that's where they need to be. The other thing I want to highlight is what you just mentioned. Look, the FDA warning, it is part of the informed consent. What you said, only if the patients knew. If you come to me, we live in the Motor City here, Detroit, and you come to Detroit and I tell you, come here and this is a car, it's going to break down in 10 to 15 years and it might die on you, i.e. cause cancer. And this car will give you transmission problem, alignment problem. It might have problems with the gear or the axle, the alignment. Will you buy that car? Never. You don't
Never.
even look at it. If I'm a
I
young
will not
patient,
take the risk.
yeah, if I'm a young patient or I'm a patient in my 50s and someone tells me, sign over here that the implants are only meant to be in the body for 10 to 15 years and that the implants are, so this is the FDA warning, by the way. This is the FDA warning. Sign over here that the implants are meant to be in the body for 10 to 15 years, that they cause lymphoma, the BIALCL, and that they're associated with breast implant illness. You will run away as fast as you possibly can without even looking back. And this is exactly what you mentioned. This is the informed consent that the patients need to be made aware what they're signing up for, not naively or blindly accepting what has been mistakenly and in error reintroduction of what used to be a banned silicone implant in 92, once again in the market in 2007, without any scientific data, if you will, that was highlighted in a recent study in the Annals of Surgery out of the MD Anderson, where they looked at the studies of studies and pretty much reproduced exactly what you and I are discussing and what the patients are screaming out loud. So now what I want to do is, Dr. Henry
And
Dijkman, if you can, yes, please.
yeah, and one more thing, when you have breast implants, silicone breast implants, and you want to get pregnant, or when you are pregnant, that is also a very high burden for the embryo. Then we see now in our investigations and also in our animal models that those silicon molecules can migrate through the placenta to the embryo. And we see there a lot of problems and disturbing the embryogenesis. So please be aware that silicon implants are not inert, and they bleed and leak from day one.
Sure. Can I mention one thing that is a very important? And again, I'm learning from my scientific colleagues. So this was a paper out of the MD Anderson where they looked at, this is the same paper in the Annals of Surgery. Unfortunately, it was not published in a plastic surgery journal. That would have been only more appropriate. But this is the Annals of Surgery, where they published this big study out of the MD Anderson, where they looked at 100,000 ladies, 80,000 had silicone implants, 20,000 had saline implants. This was a study that was published a couple of years in 2018 that showed that the lady, and this was a study of studies that showed that the ladies, this is the paper I'm quoting, this is not my data, this is a paper that was out of the MD Anderson, a major reputable organization of the world, the #1 or #2 cancer center of the US, that showed that the ladies who have breast implants had a significant higher number of stillbirths, meaning spontaneous abortion. And I will tell you anecdotally from what my patients have said. For example, there was a young patient of mine in her early 40s. She was driving back to the Midwest, and she reported she had premature menopause. If I may mention, this is its lights again. So she had this young lady in her early 40s, and she had premature menopause in the 40s, early 40s. And then as she was driving back to the Midwest, she noted that she started to have her monthly cycles back. She was so shocked. She sent me a picture and she said, "Look what happened." And she is in the medical field. And I will tell you, these are the stories that I'm hearing from the ladies who are introducing, and again, anecdotally, there's more research that needs to be done. They're doing IVF, in vitro fertilization, and they're having problems basically conceiving. And again, what you're mentioning now, more research, more data needs to be done. And I say this to everyone: if it's affecting the hair follicles, the eyes, the brain with the migraines, the neck and back pain, the hearing, the vertigo, that metallic taste in the mouth, the dryness of the eyes, the mouth, the difficulty breathing, fibromyalgia, the chest pain, difficulty breathing, shortness of breath, palpitations, the breathing problems, the heaviness of the chest, the shoulder problems, fibromyalgia type symptoms, like I mentioned, the gastrointestinal symptoms, rheumatological problems, the rashes. Don't tell me the reproductive system is spared. Absolutely, the endocrine system is involved in every cell of the body, just like you did on your cadaveric study. The cells of the body had in it the silicon, and you showed it again with that three-phase, the triple-phase electron microscopy.
Systemic toxification.
Right.
That's
Now,
it.
are you able to see some questions that some of our audience members may have asked? Are you able to see that?
No,
I
I
have
haven't
my
seen
backup
them.
phone. I'm going to go ahead and look and see if I can. I want to go ahead and if there are any questions anyone can ask, I'm going to actually go ahead and look just so that I can. Uh, yeah, implants are hormone disruptors. And again, now one of the other few questions that I got asked is this from our last that many patients have asked me. What can be done about those patients where the entirety of the implant capsule plus any inflamed tissue is removed by me as a surgeon, as a board certified plastic surgeon, and now the patient we know has a lymph node biopsy that shows silica because they did a biopsy? This, what can we do? The silica that has deposited in the other subcutaneous tissues, or a ruptured implant patient, what can we do to remove it from the body? So what is the antidote?
I yeah. I have only knowledge from other patients. And what they do is trying to detox themselves. And what I now learn from those
Yes.
patients, and we have not the optimal solution, but what I see is everyday vitamin C, 1000 milligrams, Gorella, inositol, and nanozeolite, that from root brands, that can help to extra detox your body, to extract heavy metals and to try to extract the silicon. But what we see is when you really have a full loaded lymph node, then it's very, very difficult to extract the silicon. And so that is a very huge problem. But when you would be remove the lymph node via surgery, then of course a lymph node is a very important organ, and you will get disturbances in water fluid and content. So you get edema. But on the other hand, so try to detox. After 1 or 2 years, when you have lesser complaints, or with a echo you see a decrease of the snowstorm image, then maybe you are on the right track. But when you don't see a decrease, I think you have to extract the lymph node via surgery, because you will never recover when there is so much silicon still in the lymph nodes. So it's a problem. So
Right.
for
Now, if
that,
I may
I
mention,
really
a very,
recommend.
yeah. So yeah, if I, please, yes, yes, please go ahead. Sorry, there is a 10-second lag phase. So when I listen and I respond, I cut you off. It gives you the illusion. So please go ahead. Sorry, sorry.
No, no
So
problem.
I recommend, yes.
Yeah, so I recommend that when you get complaints, and after 5 years or 8 years, you have to make an MRI. Please prevent that there is a rupture. Then when a plastic surgeon say, oh, it's a silent rupture, there's no problem. When you have a rupture, also when they call it a silent rupture, you have a lot of gel bleed. You have a lot of migration of silicon into the body. So you have to prevent that. You have to prevent always a rupture. Then it's such a high risk. When you get a rupture, the risk that you
Right,
get
right. No,
migration into the
you have
lymph
to,
nodes
yeah,
is so
you
high.
will never know. Yeah, you will never know when it's going to happen. It could happen tonight. It could happen in 10 years, 5 years, you know, and very important. Now, one thing I want to mention here is this. As a physician, as an MD, as a clinician, as a general surgeon, and again, I am not like a toxicologist, but I will say this. Number one, if you have a orange a day or a lemon a day, that in itself is all the vitamin C you will need. Otherwise, if you keep ingesting 2, 3, 5 vitamin C pills a day, you can get vitamin C toxicity. And God knows nowadays when you get a vitamin C pill, likely made in China, it is probably pure chalk, disintegrated vitamin C. I have actually in my I'm a biochemist from my undergraduate when I have actually synthesized vitamin C in the lab, i.e. we started off with the structure and we built the vitamin C and then we checked the vitamin C, the purity of the vitamin C. So having done this, I can say if you take a healthy, i.e. a lemon or a orange, that's all the vitamin C that your body will absorb if it needs it. If it does not, it will excrete it. But to take pills, now someone says, I'm going to go ahead and take celery juice. Guess what? Celery juice is good. It is organic, it is natural, and anything, raspberries, blueberries. But for someone to say, I'm going to go ahead and take an IV infusion of vitamin C, unjustified, uncalled for, no scientific evidence. People are doing this apparently for COVID as well. No scientific. Same thing with probiotics. The body in itself replenishes the bacteria. If you look, millions of colonoscopies are done. How many times does the gastroenterologist say, well, you have to take the probiotic to, or the diarrhea that the elderly gentleman or female has at the hospital or at home? Do they say you take probiotic? No, no one says this. The gut itself is smart. It will replenish. If you take lactobacillus yogurt, that is natural and healthy. Some people say take 2, 3, 4 different brands, and over time, the body in itself takes care of it. No infrared sauna will take the silicon out. And now, you know, if you have silica within the lymph node, chances are you have silica outside in the other lymph nodes, the 20, 30 lymph nodes, and you cannot remove those because you're going to get lymphedema. So, and then if it's past those lymph nodes, it's likely in the subcutaneous tissue and the rest of the body. So I say to you, and again, more research needs to be done. One cannot, this world of this concept of detox. I have a lady, 28 years of age from New York. She sent me a list. She went to a naturopathic doctor. I'm going to give glucosamine, chondroitin, garbage, no need. Vitamin C pills, garbage, no need. Vitamin D, garbage. You know, I said, what if you're going to get vitamin D toxicity? You're 28, your bones are not breaking down. And then next thing you know, you absorb more calcium, and then you get kidney stones, or you have premature deposition of calcium in the arteries or elsewhere in the body. The body itself is super intelligent, super smart. It look, even with breast implant illness, it tries its best to mask and fight it off. The first order of, and now again, more research needs to be done, but this is my answer. What you mentioned, this nanolite or any, this is pure, utter garbage. Otherwise, guess what? The liver cirrhotic person or the dialysis patient would be taking it, right? And again, please don't get me wrong. I say this out of respect, out of humbleness. Sometimes I'm being like very gentle, and the patient said, well, he never said no. So when I use the word, harsh word, I kind of want to pass the message on. Don't waste your money. Like I told the 28-year-old lady from New York, she's going to a naturopathic doctor who's billing for all these herbal medications. You don't need that. What you need is a good plastic surgeon who will remove the entirety of the implant capsule plus any inflamed tissue such that you get the burden removed. And this is, if you will, very analogous to, you have a swimming pool and you have a dye, for example, a ball of a dye, and you throw it in the pool. The gel bleed is occurring. The first order of business is remove that big ball of gel or that dye that is bleeding in. Once you remove that definitively and in the periphery, then guess what? At least the silicone, and again, from your studies and the other studies that have been done, at least the burden of the silicone is removed, because chances are, if it's in the silicone, it's in the rest of the body or other concentrations in other tissues of the body. So at least, and then the body in itself over time, and again, I'm just basically, because I asked Dr. Atul Mehta, who is a pulmonologist out of the Cleveland Clinic, here is a patient who he managed, just like you, sir. He took the lung biopsy of this patient who had shortness of breath, difficulty breathing. And in that lung biopsy, because he's a transplant pulmonologist, he showed, just like you did, electron microscopy and by energy dispersive x-rays, that there was silica inside the lung. I asked him, and again, he taught me, and I knew, if you go back and look at the Atul Mehta slash Facebook Live that I did with him almost a year ago, he said the silicon made it from the bloodstream and deposited into the lungs. And that's why when I did the biopsy, that's how I saw it. Then I asked him, what did you do for your patient? He said, I did plasmapheresis, where he actually cleaned out the plasma. Now, I do not understand the dynamics of the filtration and how the plasmapheresis, but he said this cleansed, and over a year, the patient was able to recover and bounce back, and the symptoms of breast implant illness improved, and the patient overall did fare well. So we know it goes in the bloodstream, right? Because that's how it made it to the rest of the body, right? That's why it made it to the spleen. That's why it made it to the brain from your study, right? From your cadaveric study. And we know from what Dr. Atul Mehta said, because it is in the bloodstream. And the point I'm trying to make here is that the real, there is no such thing as detox, if you ask me as a clinician, as an MD. Otherwise, none of my patients would be showing up. Many of them, as you will see, they spend $500 to $2,000, God knows how much, and they have a bag full of herbals, and they're like, we're taking all of this in order to improve. And if you think about it, it's very ironic. They have a non-organic poison, the word that you used 20 minutes ago, inside their body, that's leading and leaching and bleeding silicon. And here they're doing this organic herbal intake in order to detoxify. So the goal here is to remove the entirety of the implant capsule plus any inflamed tissue such that there is no toxic burden left behind, and then giving the body by diet and exercise, organic diet, eating a vitamin, eating an apple, eating high fiber, eating high protein, regular protein, a balanced diet, organic diet, such that you give your body a chance. Now, there is no like antidote that is given that will bind the silica. I had a patient that came to me. She went to a local aesthetic non-professional, and they injected silicone into the buttock. This is professional grade silicone in order to quote do butt enhancement, which is very common we see in Florida and New York. And what they did was almost 100 injections of silicone into the buttock area. I had a CTA, which is a CT angiogram, in order to see, and you can see the whole buttock area, the gluteal subcutaneous tissue, all light up from the silicone causing the inflammation. And she feels like there are worms in her buttock going down the leg because this is the gravitational pull of the free silicone that was injected. There is no solution except for maybe liposuctioning that area, because we know there is a high concept. But this is a lady. I did not operate on her. I did not do, because I personally did not know. I wanted to know what exactly was the composition, so at least we would have a chemical that was injected in her, so that once we know what the chemical is, maybe a toxicologist somewhere in the US would be able to determine an antidote for that. I did not operate on her, but I said this is the whole region that has in it the silicone. So going back to the question, there is no such thing as detox, in my humble professional opinion. Taking vitamin C, vitamin D pills might be overkill and actually be detrimental, including probiotics. Removing the implants safely, completely, definitively, not only with the implant capsule plus any inflamed tissue. If there is a doubt in my mind, I remove it, because unless the pathologist sees it, we won't know what it is. So that we give the patient the best chance, such that the patient is void minus all these major, at least, silica that's in the periphery, because that's where the highest concentration of gel bleed is, and the patient gets a chance to bounce back to a normal state of good health. And that's my take. Now, can I prove? No, I cannot. And this is where the burden is on the manufacturers, the other scientists such as yourself, and the other colleagues, the toxicologists, who can find the right antidote. Now, we can do a blood test on some patients, and if there is free floating silica that is detected, because that's, remember how Dr. Atul Mehta said, and that's how the free silicon made it to the rest of the body, right? That's how it migrated to the spleen, that's how it migrated to the soft tissue. And the point here is more research needs to be done, and I'm trying to put the two and two together. But today's Facebook Live, we have actually put the two and two together, and the fact that the saline within the intact saline implant has in it spheres of silicon, that if it's going into the saline, it absolutely is, just like you have said in your studies, migrating outside of the body and hurting the body and causing what are the many systemic effects of silicon toxicity. Please go ahead, sir.
Yeah, no, I agree in a lot of things. I thought maybe when you are really ill and when your immune system is so much triggered and so abused, then maybe extra vitamin C can help you. But we also know eat an apple a day, it keeps the doctor away. So it's a difficult discussion, but and
You're right,
I'm
and we
sure
need to do
that
more research. I
migration,
agree with you.
and I'm totally agree that silicon migration goes via the lymphatic system and the blood system, but it also cleared very fast, and it goes to all the tissues and organs and etc. etc. And the most important thing is when it reaches the nerves or the lymph nodes, then you have a real problem. And I totally agree with you. Remove the source. So you have to remove, when you get complaints, you have to remove the implant and the capsules and all the burden and clear it up. And so you do a very nice job, and I thank you for this nice discussion. And I would say keep up the good work, and hopefully we can meet again.
Thank you, thank you. And I commend you. You know, I will end with two things. For someone to say if the capsules are as thin as possible, that's a good plastic surgeon. I beg to differ. It's the contrary. Any inflamed tissue must be definitively removed because that inflamed tissue, because of visualization, because of the touch, the palpation, the dexterity of that fatty tissue tells you a lot that in it are the toxicities, and it needs to be sent for analysis because that is the inflammatory burden. You don't want to leave that behind. Chances are there is silica in it. And so for someone to say, especially someone who has no scientific knowledge and no scientific basis, that they can look at a photograph and assess and say, well, the capsules are super thin, so this is a wonderful dot. Absolutely 100% wrong. To the contrary, if there's any inflamed tissue removed, I say from my experience humbly, that I find that you have seen the fat necrosis that I've removed, the hard lumps of fat that I've removed, the micro perforations that are contained by a secondary capsule. All of that needs to go because we don't want to leave any of that behind in the chest. The second thing I want to mention is, you know, we have time only that will prove you and I to be right. It is only a matter of time. We have the evidence, and over time, the truth, just like in 92 when the implant ban occurred, it is only a matter. Look at the FDA warning. That's not a joke. That's a very serious warning that should put to an end any augmentation, period. Any reasonable, sane person in their proper state of mind who listens to the FDA and these warnings cannot willfully get augmented. And I say to the docs, you know, we need to listen to the patients because the patients are telling us what is right and what and how they're hurting and what is the proper etiquette and treatment for these. Nowadays, if you go to 10 different explant surgeons, you get 10 different answers. There's an emphasis more on a lift, and there is a complete disregard of what is breast implant illness, but a willful desire to get the patient so that a cosmetic aesthetic procedure can be done in the name of breast implant illness, which is utter nonsense. We have financial contributions amongst others that drive a practice absolutely 100% unprofessional. This is all organic. The patient is always number one, what you highlighted earlier. There is no number two. If and what we do is to help the patient and to help their state of health and mind such that they're relieved of the breast implant illness, that is success. There is no secondary gain. There is no other gain. This is the oath we took as physicians so that we offer the best, 100% best. I have nothing to gain from this. I have nothing to lose. If anything, if I did 6 augmentations tomorrow, I'd triple my salary, you know? And if anything, I feel like a trillionaire because I speak what I see and I hear the women and I hear the evidence as a biochemist in my undergrad, as a physician, as an MD who spent almost 10 years in training, and I see what is black and white. There is no gray zone here. This is clear and present danger to the health of the patients, and the silicon toxicity needs to be recognized and appropriately recognized, and such that we can offer the relief to the many patients. Please, Dr. Henry Dijkman, absolute pleasure. And I want you to please go ahead and, having said this, I will let you finish on your end.
Yeah, I thank you for this nice discussion, and I think we create together awareness, and we complete each other. So that's very nice, and I wish you a very good luck, a very happy year, of course, and nice holidays.
Thank you. Thank you. No, I appreciate it. Thank you so much. God
Okay.
bless you. God bless everyone, to whoever has listened. Please spread the word and the message and the awareness. Thank you so much. I appreciate it. Thank you. Bye-bye.
Bye bye. Thanks.